Good afternoon, and thank you to members of the committee. I am pleased to be able to give this testimony on behalf of Middlesex Health. My name is Leland McKenna. I'm the Vice President of Planning at Middlesex Health. Middlesex Health is a independent hospital in Middletown, Connecticut, primarily serving residents of Middlesex County, but contingent towns as well. And so we have submitted written testimony, so I'm not going to regurgitate that. Middlesex Health is 100% aligned with CHA and the testimony that they provided earlier. We think that there's a tremendous opportunity, and first let me start with the logistics. We support, Middlesex Health supports the provision of Senate Bill 84 that goes towards eliminating occupational licenses, so that's the portion of the bill that we support. The portion of Senate Bill 84 that we are opposed to is the hospital tax. We agree with the Connecticut Hospital Association. We think that the time is right, that there's a better deal to be struck not only for the state of Connecticut, but also for the patients and for Connecticut hospitals. And we think there's an urgency to that, and that's why I'm here today testifying for Middlesex Health. It is one of our top issues this legislative session. It is so critical to the way that we operate. What happens not only with the provider tax, but what happens with Medicaid rates moving forward, and everything is connected. So just a little bit of a different approach so that I don't, again, kind of repeat what my colleagues have mentioned. Let me give you a little bit of kind of a day-to-day of what's going on with Middlesex and why this is important. So we are in the middle of a strategic planning cycle. And in that strategic planning cycle, there are 20 to 25 things that we're trying to accomplish. And those things are improvements to outpatient behavioral health, investments in our women's health and OBGYN practices, continued investments in primary care and urgent care, not only from an access perspective, but also from a recruitment and a retention perspective. We are making investments in AI and technology, and that capital expenditure is just going to grow as the years go on. And so for an independent hospital like Middlesex, this discussion and the provider tax and really maximizing what we can get back from the federal government is critically important to us. And so I'm here today to again, let everyone know that Middlesex is fully aligned with the Connecticut Hospital Association's testimony, and we think that there's a better deal to be had. And thank you very much for listening to me today.
Thank you. Questions? Thank you.
Thank you.